This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right. It's great to see so many people out here. My name is Brian Sunwoo. I'm one of the PGY4 chief residents over at NYU, Rusk in New York City. It's really exciting to be able to speak to everybody tonight. I'm really happy that we have so much interest in PM&R. So just to get started, let's see. Just a brief history of NYU and PM&R at NYU. So kind of the major player that first brought PM&R to New York City was Howard Rusk back in 1948. So he was kind of a titan of the field itself back in the early days. And he essentially established the first university-affiliated department of rehabilitation medicine. So NYU's had a lot of firsts as far within the PM&R world. They developed the first aphasia protocols, developed the first vocational reintegration, first pediatrics department with, and then the first rehabilitation psychology department as well. And then the department was essentially renamed in his honor back in 1984 due to all his work that he provided. The Rusk mission statement is to provide patients with the necessary physical, social, emotional, vocational, and recreational skills to reach the highest possible levels of independence and quality of life. And this is just a picture of Dr. Rusk on the right here. So our program leadership consists of our chair, Stephen Flanagan. He is a full professor of rehabilitation medicine, chair of the Rusk Rehabilitation Board, as well as a PM&R National Board Secretary. We have Dr. Alex Morose, who is our program director, and he serves on a number of chair positions as well within NYU and on AAP. We have Assistant Program Director Dr. Francis Lopez, whose focus is on curriculum, and then Dr. Cynthia Racine is another one of our associate program directors, with her focus being on professionalism. We actually have a bunch of chief residents in my year, so I'm one of 6, and having so many chief residents allows us to focus on a lot of different goals that we want to work on throughout the year. So we have chief residents that are focused on curriculum, chief residents that are focused on more site-specific day-to-day activities, and things like med student outreach, and then wellness and mentorship as well. So a little bit of details about the PM&R residency at NYU. We have 36 residents total, 12 advanced positions per year. And then we have 2 fellowships within our department. We have a brain injury medicine fellowship and a sports medicine fellowship. NYU is a model system for TBI. We have a locked TBI unit in Bellevue Hospital, which allows us to provide very appropriate care for some of our more severely patients with brain injury. And then we also have our concussion center. Within the sports medicine fellowship, we have the fellow participates in pre-participation physicals. They rotate through their Harkness Dance Center for dance injuries. They work with Division III sports coverage, and then cover professional sports events such as the NYC Marathon. So looking at the training schedule of NYU's PM&R program. So residents initially come in their PGY 2 year after completing either a medicine, surgery, preliminary year, or a transitional year. So during that time, we want the residents to learn how to deal with basic training, familiarizing themselves with acute care management of patients, exploring some any kinds of electives such as neurology, radiology, rheumatology, things that are somewhat pertinent to PM&R. Coming into the PGY 2-year, there's a focus on inpatient medicine. So we spend about 8 months of the year in the inpatient rehab unit, and we learn to manage issues such as traumatic brain injury, spinal cord injuries, orthopedic rehab, amputation rehab, and then as well as rehabilitation emergencies, which would be somewhat similar to like a medicine intern year. Starting in our PGY 3-year, there starts to be more of a transition towards outpatient. So it's a bit of a higher amount of outpatient compared to inpatient. There's a focus more on consult services, introduction to pediatric rehabilitation, and then starting to be more of a focus on procedural skill development, such as ultrasound, musculoskeletal peripheral joint injections, fluoroscopic guided injections, and EMGs. And then finally, in our PGY 4-year, we are primarily outpatient based, and there's a lot more of the same as in PGY 3-year, but also more career planning and fellowship planning, sort of transitioning into more of a leadership role among the resident team and clinics, and then learning to navigate the entire rehab ecosystem a little bit more competently. And then all of our PGY2s are assigned an attending mentor when they come into our program, and they're essentially joining a resident family with a PGY 3 and PGY 4. We're trying to do a lot more as far as fostering those kinds of relationships. So the program is supporting regular monthly dinners with your mentor family as well. And then you can always change your mentor as well throughout your residency career to more closely align with your career goals. So where do our residents go? So being a major academic center in New York City, we have a program that's existed for a long time. We have residents that have gone basically everywhere around the country. So in the past 5 years, we've had a number of residents match into ACGME pain, sports, pediatric rehab, spinal cord injury as well, and then as well as the non-ACGME accredited sports and spine medicine at a number of different spots, as well as non-North American Spinal Society sports and spine, academic jobs, private practice as well. And then NYU itself offers a few other fellowships that are outside of the PM&R department, including pain medicine through anesthesia, palliative care through internal medicine, and then neuromuscular medicine through neurology. NYU itself has, the program has 3 locations that our residents primarily rotate through. So we are working at NYU Langone Health, Bellevue Hospital, which is associated with New York Health and Hospitals, and then the Manhattan and Brooklyn VA. So these are kind of nuanced in their own ways. NYU Langone Health tends to be more private patients. New York Health and Hospital tends to be is a public hospital, so we see patients from a lot of times from a lower socioeconomic status. And then the Brooklyn and Manhattan VA, we see a veteran population. And then all of this is just a quick map of NYU's location. So almost all of our sites, except for some of our Brooklyn sites that we're at maybe 1 or 2 months a year, are essentially along First Avenue within like a 20-block radius. Generally, it takes the longest distance from one location to another is 30-minute, like a 20-minute walk. But generally, you won't have to commute from one location to another unless you're going to our didactics. And then we also have our main inpatient sites are at Tisch Hospital, this 22-bed inpatient unit. Bellevue Hospital has 30 beds, and then Langone Orthopedic Hospital has 48 beds. And then we have a number of outpatient clinics throughout this area as well. This kind of just goes over what I just said again. All our sites use Epic. We have outpatient clinics in pain, sports, EMG, oncology rehab, TBI, stroke, spinal cord injury, pediatrics, cardiopulm, brace, muscular dystrophy, diabetic foot and ankle, and then also a dance clinic as well. This is just a brief outline of our residency schedule. As I mentioned, we do about 8 months of inpatient in our first PGY 2-year, and then 3 months of inpatient PGY 3-year, and then really 2 months of inpatient in our PGY 4-year. So it becomes a transition from there. And then within the residency schedule, there's 3 tracks within the PGY 3 and 4-year to accommodate early elective exposure for those interested in pursuing fellowships that require early applications, such as ACGMA pain or the NAS sports and spine medicine. We have a number of call sites that we run through. HCC 9, which is our medically complex unit. We used to have 24-hour calls there, but they, about 2 years ago, we transitioned that into a weekend only 7 a.m. to 7 p.m. call. Bellevue Hospital has overnight calls, and then our Langone Orthopedic Hospital has overnight calls. And generally, you would get a post-call day after a 24-hour call. And then we have iPhones and pagers as our methods of communication, as well as Epic Chat for any kind of nursing needs. As far as our call frequency, I think we actually have a pretty good call schedule compared to a lot of other programs in this in the area. We have in your PGY 2-year, you have about 40 calls a year, which is about 2 to 4 per month. Generally 2 calls in a month will be weekend shifts, a 24-hour weekend, and then you have 1 month that year without any call. In your PGY 3-year, the call number drops. You generally have about 3 per month when you're on the inpatient units, and then 2 when you're on outpatient, which is 7 months. And then 2 months without call. And then PGY 4, we actually only have 8 calls a year, no weekend calls, or no, so you have 2 Sunday calls, but the rest are not weekends, and generally mostly just Monday through Thursday. As far as our pay and benefits, we get 20 days of vacation. Generally, they're split into 4 5-day blocks. A lot of times the scheduling chief will try to schedule you to have a call on the Thursday before vacation, so it ends up being a Friday and then 2 back-to-back weekends with their vacation. And then we have 10 sick days as well. We have a number of medical, dental, vision plans, comprehensive mental health resources, education stipends, and conference funds. There's actually 2 payrolls at NYU Langone. One is through NYU's payroll, as well as, and the other one is through the New York City Health and Hospital CIR union's payroll. Generally, this is the current salary base. They're talking about increasing it this year. So it kind of goes back and forth. One payroll will rise, and then the other payroll essentially negotiate to match it or go above it. So it kind of goes back and forth. Some residents try to pick one based on certain aspects that they like about it. As far as technologies that we utilize within the department, we provide iPads, which include a library of books, apps that we use, Epic. We have ultrasounds at each site. We are currently subscribed to a SonoSim online ultrasound course. We have old injection models, but we just got new injection models this year. So those are definitely useful for practicing peripheral joint injections. And then we have basically unlimited books provided through our NYU's hospital's virtual library. Okay. As far as our curriculum, we go through a 12-month cycle. So in an entire residency, you'll go through the curriculum 3 times. We have ultrasound workshops in person every 6 weeks. We have a weekly journal club, grand rounds on the first 3 Wednesdays of each month. We have specifically designated mentorship lectures. We have research didactic curriculum. And then we also, as PGI4s, attend an annual P&O and board review course. We also have injection didactics in the anatomy lab. And then every, essentially 2 to 3 times a month while on outpatient, we do small group ultrasound workshops as well. Overall, the culture at NYU, I think, is really great. I think right now we have a very supportive group. co-residents attendings. I've never felt uncomfortable around expressing my opinions with our attendings. And I feel that we have a culture that supports one another. Our residents generally try to bat for each other. We try to step up when our co-residents are ill or having issues. And I think we've been really good about our just general culture of kind of supporting one another. We're always striving to improve. We have quarterly town halls with our chief residents and program director, where basically our residents are able to voice their issues ahead of time, and then the chief residents will sort of navigate through those problems with Dr. Moroz and our associate program directors as well, try to come up with solutions. We've had a lot of success in the past few years as far as our workload and our call schedule. And so it's something that we feel is really useful. Generally, things are resident driven. I would say our leadership allows us to kind of come up with plans and will kind of steer us in the direction, but they like us to be independent. And I think that's really useful for us because it will help us essentially become strong physicians that are independent in the future. And then overall, I think we have a good work-life balance and supportive culture, like I was saying, for new parents and breastfeeding as well.
We got about 4 minutes left.
Okay. All right. So New York City it's a very fun place to live. I don't really know if I need to say too much about it. There's just some pictures of things we'd like to do: ice skating, rock climbing, baseball games. Over here is one of our former chiefs running the marathon. Lots of things to do in New York City. And then this is just more pictures of us all hanging out. We generally try to have a good time. We're a very large program, so not everyone likes to go out all the time, but there's generally someone who is hanging out at any given time. So it's always easy to find people to interact with and do things with. This is my contact. I will share the slides with the group afterwards. And these are program coordinators and program associates. Feel free to reach out for any questions, any information that you have, or just any general advice, because I love talking to people. And then this is our website. This has a bunch of information, videos addressing our curriculum. It has resident interviews, site tours, and then our resident bios and faculty bios as well. There's a virtual tour map of our campus, and then we have an Instagram as well, NYU GSOM. It's a very unfortunately long name for Instagram, but it's part of the policy of the program that it has to be this format. Any questions? Let's see. Stop sharing.
Folks can either type it in the chat, or if you guys just want to unmute yourselves to ask questions. Oh, I think there's one question in there.
Hey, I see from Austin at NYITCom. So as far as advice for what we look up for in our auditioning students, we really want you to be, enthusiasm is the key. PM&R is not something that's you generally have a large amount of exposure to, and most people have in med school. So we want people who are enthusiastic and ask questions. So things that you can do, specific examples of things that you can do on the rotation are ask to write notes, ask for feedback, ask to see the patient. If there's anything where you're uncertain about, feel free to ask, because it helps us to learn these things as well when we're residents, from the resident perspective, because sometimes we may just do things because that's how we were taught. And when we have a student come through and actually ask us why we're doing it, it forces us to think as well. And that shows that a lot of critical thinking, which I think is what I, as one of the chiefs, is really looking for in our class. So really just try to step up when you can, try to be helpful, and just try to be personal as well.
Thank you. I appreciate that.
Yeah, no problem. I was wondering if, I see a question from Anju Sanchala. I was wondering if step 1 is a requirement for DO students. I don't think so, no. And then from Mert, hi, thank you so much. Is your university non-US IMG friendly for PM&R? I would say in the past, I don't think we've matched any IMG residents, to be honest. I can give you a little bit more information if you want to message me privately and just share your contact information. I can reach out to you and let you know if we've had any in the past. I don't recall any in the past few years though, unfortunately. For Devine, that's sort of a similar question. So Devine, if you want to message me or shoot me a private message or shoot me an email, I can definitely look into that for you more in depth. All right. And then from Muzammil Ali Khan, how do you guys balance PGY receiving pain medicine exposure with the fellowship program there as well? So that's something that has been absolutely a challenge for us in the past few years because there's a lot more interest in pain medicine. So traditionally, we've had it so that we're a large class 12 residents. Traditionally, we've had it where those people interested in pain will generally get certain rotation tracks that allow them to have pain early in their PGY 3-year, as well as having some elective time early in the year. What's been the issue is that like for example, in my year, we've had so many residents that were interested in pain, like over 6 of us. So it was difficult to kind of get that schedule to work. In general, the advice that we were given was that as long as you're able to get a pain rotation in within the first 6 months of your PGY 3-year, the point being to get a letter of recommendation for fellowship, it should be fine. And that hasn't been a big issue for us. Beyond that, if you want more exposure in our PGY 2-year and PGY 3-year, we have a number of rotations where you have a lot of academic half days that are available to you. And a lot of times what our residents will do is essentially reach out to pain attendings that don't have anyone scheduled, or essentially any interventionalist attending that doesn't have anyone scheduled, to get a little bit more time and practice in beforehand. And that can help you if you have somewhat of a later rotation in the schedule, just to get your feet in the door and let them know that you're interested in the field and connect with them if you want to work on any research together.
Awesome. Thank you so much for that presentation. If you wanted, yeah, you can always drop your contact info in that group chat for the candidates if that works. That way, if there's any other questions, I can ask you.
Yeah, I'll type it in.
Perfect.